In this article we talk about indomethacin, which was synthesized in the mid-60s of the last century. Among the group of non-steroidal anti-inflammatory drugs, it stands out for its powerful anti-inflammatory effect. Statistics from the World Health Organization say that every day 30 million people in the world take non-steroidal anti-inflammatory drugs. These medicines came in second place in terms of use after antibiotics. Now more than 1,000 names of medicines of this group are known. What is included in indomethacin? In indomethacin, the active ingredient is a substance of the same name, which refers to derivatives of indoleacetic acid. The chemical structure of indomethacin is related to diclofenac and ketorolac. Indomethacin suppresses the synthesis of prostaglandins, which control the inflammatory process, and inflammation is accompanied by pain, swelling, fever. Thus, indomethacin acts as an analgesic, fat-reducing and anti-inflammatory agent. In addition, the drug reduces blood clotting. Indomethacin penetrates 80 to 90% into inflamed tissues. The substance is well absorbed through the skin, gastric and intestinal mucosa, penetrates into the joints through the synovial membrane. The drug is used for joint pain of rheumatic and non-rheumatic origin, pain syndrome after trauma operations, damage and inflammation of tendons, myalgia and neuralgia, dysmenorrhea, inflammatory and degenerative disease of the musculoskeletal system, joint syndrome with rheumatism and exacerbation of gout, rheumatoid arthritis, pediatric arthritis, ankylosing spondylitis, osteoarthritis, osteochondrosis with root syndrome. Sciatica, inflammatory lesion of ligaments and tendons. Bursit and Schaas. Lumbago, muscle pain of rheumatic and non-rheumatic origin. Mastotraumatic inflammation of soft tissues and musculoskeletal system, ligament injuries and ruptures, bruises. Indomethacin is a symptomatic remedy that eliminates pain and inflammation at the time of application. It does not affect the causes of the disease. It is presented in pharmacies with the following dosage forms: tablets in 25 mg. Ointment for external use is a 10% rectal candle of 50 and 100 mg. Indomethacin in the form of ointment penetrates well through the skin. The composition of the product includes dimexide, which improves the penetration of the active substance. With regular use, indomethacin accumulates in muscles, joints and synovial fluid, from which the ointment helps, relieves pain, swelling, improves the volume of movements and reduces swelling and stiffness of the joints. What is used for? Indomethacin ointment has proven itself in the treatment of gout, arthritis, osteochondrosis, sciatica, myalgia and neuralgia, ischiasa, lumbago, injuries and inflammation of muscles, tendons and ligaments. Ointment is purchased at a pharmacy without a prescription. The duration of treatment is no more than 10 to 14 days without consulting a doctor. Indomethacin candles for prostatitis. Most manufacturers do not indicate in the instructions for the use of candles with indomethacin such an indication as prostatitis. Candles are injected after emptying the intestine deep into the rectum. The maximum daily dose is 200 mg. For maintenance therapy, the dose is 50 to 100 mg per night, with course treatment, 50 mg 2 or 3 times a day. Indomethacin for hemorrhoids. Hemorrhoids, contraindications for indomethacin means causes exacerbation of the disease, provokes hemorrhoidal bleeding. When using drugs in candles, side reactions, irritation and heaviness in the anorectal area occur. Indomethacin during pregnancy. Indomethacin in candles and tablets is contraindicated for use in pregnant women. The drug can cause water scarcity, as well as impaired kidney function in infants. Ointment up to 20 weeks is allowed only on the recommendation of doctors. Indomethacin penetrates into breast milk. If according to indications it cannot be replaced with a suitable analog, then breastfeeding is stopped for the duration of treatment. Indomethacin side effect. The group of non-steroidal anti-inflammatory drugs, including indomethacin, are characterized by serious side effects. Their use for months and years damages the gastric mucosa. This is fraught with the appearance of erosion and ulcers, in severe cases, bleeding and disappearance. If, according to the indications, a prolonged intake of indomethacin is needed, then it is prescribed under the guise of drugs that reduce the production of hydrochloric acid. For example, omeprazole. Other negative reactions during treatment with indomethacin are abdominal pain, diarrhea, nausea, vomiting, heartburn, swelling, increased blood pressure, dizziness and headache, dyspnea, bronchospasm, skin allergic reactions, gingival, uterine, hemorrhoidal, gastrointestinal bleeding. To reduce the risks of side effects, indomethacin is prescribed in minimally effective doses and short courses. Indomethacin analogs drugs from the group of non-steroidal anti-inflammatory drugs belong to the analogs of indomethacin. Ointments and gels are available without a prescription. They are used for no more than 2 weeks without consulting a doctor. Indomethacin has a direct analog, methindole retard. It is available in long-acting tablets with a dose of indomethacin 75 mg. The list of indications for use is less than that of indomethacin tablets. It is used strictly as prescribed by a doctor for rheumatic diseases of the spine, joints, and soft tissues, gouty arthritis, pain syndrome after injuries and operations. The following analogs contain other active ingredients: ibuprofen, diclovit, diclofenac, Volta, nice, nimesulite, naproxen, Motrin, Nalgesic, Paroxyc, Amylotex, Meloxicam, aceclofenac, ketorol, ketanov, ketoprofen, Ku. If indomethacin was prescribed by a doctor, then it is better not to replace medicines with analogs with a different composition without his advice. Indomethacin or diclofenac, which is better? The drugs have related chemical formulas and have the strongest anti-inflammatory effect of the entire group of nonsteroidal anti-inflammatory drugs. The effectiveness of indomethacin and diclofenac has been proven on a large amount of clinical material. Indomethacin gives the best result in the treatment of ankylosing spondyloarthritis and degenerative diseases of the spine, as well as in an acute attack of gout. But it is considered more toxic. It greatly harms the stomach and intestines, and prolonged use increases the risk of bleeding and destruction of cartilage and joints. Taking diclofenac is safer. The remedy is allowed for children from the age of 6, and indomethacin, only from the age of 14. Diclofenac has a greater choice of dosage forms: tablets, ointments, gels, candles, injections. If you like this material, please subscribe to the channel and click on the bell to receive notifications, and also like it.